what is your position on universal Medicaid, single payer, and how would you improve the current health care delivery system? And we'll begin at Eric Lane's side of the table.
So single payer is a future state, I believe. I don't believe that it's a today thing that we can accomplish. If it sounds simple in concept, but it's a hugely complex transition that would need to occur over the course of probably a decade for us to get to a single payer solution. And the reason for that is normal supply and demand economics don't work in the healthcare industry anymore. You have investors that own healthcare. You have conflict of issues that are now blurry between doctor and ownership of practices that result in much higher costs for all of us. They have relationships with the drug prescription or the drug manufacturers that they push the drug because they get kickbacks. Whether it's direct financial kickbacks or other kickbacks, they get the kickbacks. It's a perverse system that's not designed to help the efficacy of the diagnosis, nor is it there to help the cost control that we would think is inherent in a practice of mercy. Finally, this industry is driven by middlemen. This is people with my type of training in an MBA program who are totally designed to maximize revenue for the industry and not pay attention to its effects on the consumer, because the consumer in their eyes is an insurance company. They don't deal with who collects money for the insurance company and sees our rates go through the roof all the time. That needs to change. So the primary policy initiative that we have to take in order to get the first step in this game is have a national rate sheet around services and prescription drugs. If we can say that we have some government-controlled rates, then we'll find an answer for that 10-year goal. Thank you.
Allison County.
The best program, healthcare program, that I've ever dealt with, by far, was the Maryland Children's Health Insurance Program, which my children used prior to ACA, when I personally couldn't buy a policy because I'm a woman who had a complicated pregnancy. And the reason that I liked CHIP was because it covered vision, it covered dental, it covered mental health, it covered prescriptions. Everything was free and it was means-based. So if you could afford a little bit, then you paid $47 a month per child and everything was covered. We had many a chin stitched back together using that CHIP program, because we had toddlers. And I believe that that's what we should be working towards. We should be shooting for the moon, because we know that what we're going to get depends on how much of a majority we have in Congress. Why would we settle for less than we actually deserve and what we actually need? I mean, teeth are medically necessary, but won't be covered by Medicare. And there are a lot of problems, and part of it is cost control. Maryland has a fantastic all-payer system, which has significantly reduced the healthcare cost, and that can be expanded nationally to drive down the cost while we work towards a universal system that ought to be a right for people, because nobody should be making major life decisions based on the availability of health care in their lives.
Michael.
So I'm a strong supporter and proponent of Medicare for all, universal coverage. We are the wealthiest nation in the world. We pay more than any other nation in the world for our health care, $9,600 per person per year. Canada, by contrast, pays about $4,600, and they have universal coverage. Prior to the ACA, 45,000 Americans died every year from lack of access to health care. When I started this campaign last August, I was at the Talbot County Ag Fair, and I was talking to a vendor. A friend of hers had been diagnosed with cancer, didn't have coverage, and we know the course of that disease. She died with stage 4, finally being admitted to the hospital to die. We can do better. We've got to do better. How do we improve the current system? We expand CHIP upward. We make CHIP coverage consistent with Medicare coverage, and we expand Medicare downward in the age groups, and we bring them together. This is what we can do. This is what we have to do. We owe it to ourselves. We owe it to each other. We owe it to the future generations. We owe it to those of us with pre-existing conditions, with illnesses that will kill them or their children or their loved ones or their family members. And this is an urgent priority for me. So thank you very much.
I personally think healthcare is a right, plain and simple. There's a term ALICE families. ALICE is asset limited, income constrained, employed. It's basically the families who are one carburetor away from next month having to choose between medicine and rent. In our district, it's 37% of working families. There are far too many medical bankruptcies, or bankruptcies that start with a medical bill. I think we're all going to be a Medicare sooner rather than later and wonder what took so long. The plan I would support is from a left-leaning think tank in Washington, D.C. called the Center for American Progress. It does three things. Number one, it takes CHIP and Medicaid and brings it under the Medicare umbrella. The second thing is it allows for an opt-in. So if you're an individual or a small business and you want to opt into Medicare, you can. And the third thing is it allows Medicare to negotiate drug prices just like the VA does. There's no reason Medicare should be allowed to negotiate drug prices. But we have to, step one is there are 54,000 people in our district who rely on the Affordable Care Act. Andy Harris has tried to repeal the Affordable Care Act every chance he had with no backup plan. Step one has to be to protect those 54,000 people. By the way, not for nothing, there are 50,000 jobs in our district in the healthcare industry. It's the largest employer. And I've gone around and I've talked to leadership from all the hospital systems in our district. If you took away the ACA tomorrow, 5% of those jobs go away overnight. That's 2,500 jobs. Step one is protecting those 54,000 people. Thank you.
Thanks.